be discussing the exploratory analysis of the IMpower010 study, which was initially for adjuvant atezolizumab versus base supportive care. And the exploratory analysis mainly aimed for the finding of the predictive markers, predictive biomarkers like transforming growth factor beta, cancer-associated fibroblast gene signature expression. So in patients, I'll go for the schema of. So this study, IMpower010, made its primary and DFS endpoint. Mainly the IMpower010 study design was completely resected stage 1B, 3A NSCLC, received 1 to 4 cycles of chemotherapy, and it was randomized to atezolizumab versus base supportive care. 16 cycles were given, and it was stratified as factors were sex, history, stage, PD-L1 status. Primary endpoint was DFS, which was made in this study, and now we are exploring the tumor biomarkers, especially tumor microenvironment potentially predictive for the DFS with the intervention of atezolizumab in adjuvant setting. Methodology was mainly bulk RNA sequence data was interrogated using input of 100 plus gene signatures related to cell type and cell state, and other biomarkers including PD-L1, TCIC status was also seen. So if we see the baseline characteristic and DFS outcomes were similar between the RNA sequence, BEP is biomarker evaluable population and intention to treat population. So both the groups are quite well matched in terms of the age, like almost 62 it was matched. Males, nearly 2/3 were males. ECOG PS was more than around 50%, smokers nearly 80%, and non-squamous histology nearly 2/3 patients were non-squamous. So if we look at the DFS data in RNA sequence BEP, it was almost same, and hazard ratio of 0.71 as compared to the what it was in the intention to treat population was 0.81. So it is quite comparable data in RNA sequenced BEP versus intention to treat population. So what are the biomarkers evaluated in this study? So we can see this TGF, beta CAF, PD-L1, neuroendocrine markers, KRAS signaling. So green ones are the positive associations and the red ones were negative associations. So TGF beta CAF is one of the inward pathway related to tumor growth and immune microenvironment. So let's see how does it affect in terms of data. So if we look at the data, mainly it was intervention arm versus base supportive care arm. Again, it was divided into the two subgroups with the high TGF beta CAF versus low TGF beta CAF. And number was quite high, like 250 patients in each group. If we look at in base supportive care arm, so high TGF arm, the red one is associated with the reduced DFS compared with the low TGF beta CAF. If you look at the median DFS, 29.7 months versus 37.3 months. So that means high expression of TGF beta CAF had a poor prognosis even in the base supportive arm. So if we have some intervention, does it change? We'll look into the subsequent slides. So this is the intervention where like we have included atezolizumab in the both similar high and low biomarker group, and it has median DFS has not reached, but the PFS, which was worst in the earlier subgroup, has reached to 0.90. So if we impose both the groups, both the graphs, so we can look into it. So the only high TGF beta CAF in the base supportive arm has poor, and it has improved the overall survival in the intervention arm. So if we look at all the hazard ratios, TGF beta, third one like TGF beta CAF high with the intervention of atezolizumab versus TGF beta CAF high base supportive care arm. So it has 0.54. So that indicates that if we intervene with the atezolizumab in the high TGF beta supportive, it improves the median DFS to the low subgroup arm. So if we see subset analysis in non-squamous, squamous, PD-L1 less than 1% and PD-L1 more than 1%, it favors the intervention even in high TGF-beta CAF arm. So to conclude this analysis, exploratory analysis of tumor microenvironment features using RNA sequence. So it has identified TGF-beta as one of the factor or one of the predictive biomarker of DFS outcomes in intervention arm with atezolizumab as compared to the BSC arm. And in the BSC arm, high TGF-beta signature expression was associated with the worse DFS than low TGF-beta gene signature expression. So we can conclude, though the sample size was limited and validation of the predictivity need further validation or further study needed, so we can conclude in the high TGF-beta CF that can be used as one of the biomarker for identifying intervention with the atezolizumab in adjuvant setting. Thank you.